Hi everyone, welcome back to For Strong and Growing. My name is Alexa and right now I'm pregnant with baby number 3. She is due on Thanksgiving, but I will be full term, aka 37 weeks, the week of Halloween. I'm doing weekly updates until the end of this pregnancy, so this video is dedicated to week 34. Also, you can probably tell by the title / thumbnail, I don't know exactly what I'm gonna write. There's also conversation about doctors pushing certain medications and what to do in that situation, because I found myself in this situation this past week. I also have experience with this from my first pregnancy, which let me tell you, it's worse going through this as a first-time mom because everything is new anyway and you are unsure of yourself. I was also very young, so there was more of a tendency to blindly believe what doctors were telling me, but this time around I knew how to stand my ground a little bit better. So I just want to go through exactly what happened and kind of what my advice would be if you find yourself in this kind of situation. So let's get into it. You know the deal. I have my symptoms written down in my notes app on my phone, so I'm just going to start from the top and go through it. First, I have swollen ankles. This is a really common pregnancy symptom, especially towards the end of pregnancy. You just retain a little bit of fluid and your feet can get swollen, your ankles get swollen. I just need to make sure that I'm drinking more water, which kind of seems counterintuitive. Like if you put more fluid into your body, you would think that it would start pooling in places that are swollen, like your ankles, but it actually helps with swelling. Next, I wrote down, I feel hiccups up high. She might have flipped breech again. So this has been the only way that I've been able to tell what position this girl is in. I am so bad at feeling for what is what. The little trick that I've been using is feeling where her hiccups are, because I'm guessing that's where her upper torso is. So first I was feeling hiccups down low, and then at my last OB appointment, they confirmed that she was down low and in that oblique position that I was kind of afraid that she would be in. But then I started feeling hiccups up high, and I'm thinking, oh, I think she flipped upright again. And then throughout the week, sometimes I felt them low, sometimes I felt them high. So I think she's been all around this past week. And by the time I went to my OB appointment this past week, she was in a head down position. That's my latest update. I don't think she's moved from the head down position since that appointment, which was on Friday. Next, on Friday the 13th, nonetheless, of course, I got repetitive Charlie horses in my left foot. The whole family went to an event at my daughter's elementary school, and I'm walking around the whole time. It was quite a bit of walking, and on the way out, a Charlie horse just gets me in my foot. It was super painful, obviously, but usually the pain only lasts for maybe 30 to 60 seconds and then it goes away and it kind of just is crampy after that. But I was getting repeat Charlie horses. It would not go away. So I was like, am I holding it in a bad position? I tried changing all these positions. I mean, I could barely walk. So I'm like sitting down, I'm trying to take weight off of it. I'm trying putting weight on it, just seeing what's going to help. But they kept just coming back over and over again. It was really annoying. Eventually they did go away. I don't know what that was about. My best guess as to what happened is that number one, I was walking on the grass, and number two, I was wearing these brown clogs. After walking on that for too much time, I think it just messed up my feet. I will be avoiding grass now. I'm sticking to the pavement because that stunk. Next, I have need help standing up from a sitting position. So this one is hard for me because I'm Little Miss Independent and I don't like asking for help. My belly is just so big at this point that I really do need help. If I am sitting down on the ground, it's going to be a lot of work for me to get up by myself, and I might possibly hurt myself in the process. So it's just better for me to ask for a hand up. Okay, I have getting up in the middle of the night more to pee. This is another really common symptom, especially in the 3rd trimester, as baby gets bigger and is head down and is pushing on your bladder. It just feels like you have to pee all the time. That includes in the middle of the night. I don't do it every single night. I would say maybe half the time or a little bit less than half the time. Sometimes I just deal with it, to be honest. I feel all the pressure and I probably should be going. Like, I probably shouldn't be trying to hold that all night. Sometimes I am just too tired and too lazy to get up to go, which is funny because Literally, I'm sitting on my bed here. My bathroom is right there, that white door. It's a very, very short walk to get to the bathroom. And in my last house, I had to go from my bedroom up a set of circular stairs in the middle of the night to get to the toilet. And I would be like, you know, when you're trying to keep yourself asleep and you're trying to not wake up too much as you're doing things in the middle of the night. So I'm trying to like keep myself in that sleepy mode, going up circular stairs with my center of gravity shifted with my giant belly up and down those stairs. Oh, it was so dangerous and so annoying. And now I won't even get up to go right there half the time. So there's something to be said about my laziness apparently in this pregnancy. I have thought to myself, maybe I should just put on an adult diaper. Ew, that's so bad. I shouldn't admit that. Shh, never mind. I'm not gonna do it, but I've thought about it. Okay, so now we get to my prenatal appointment. I did have an appointment this week at 34 weeks. They took my weight, which they always do. I never have been adding my weight into this, but I wrote it down. It was 127.6 pounds. And I'm pretty sure I started at around 102 pounds. So I've gained almost 30 pounds, which is a good amount of weight. My blood pressure was fine. They checked the fundus height and they used the fetal Doppler to listen to her heart rate. That was 138 beats per minute. And then the doctor palpated to confirm that she was in the head down position. One thing that was weird was my doctor asked if we wanted to pick a date for delivery. He didn't say delivery though. He was just like, so you guys, my husband was also there. He's like, so you guys got a date in mind? Like, what are you thinking? You just gonna let this happen? I was like, for delivery? What do you mean, do I have a date? I don't get to pick. Not at this stage. I didn't think I got to pick at 34 weeks. He was like, yeah, for delivery. And I'm like, oh, we're just letting it happen. I didn't even think that I got a choice. At least not until 40 weeks. I wouldn't schedule anything until I think 41 weeks is the longest that I would go. But I've never made it to 40 weeks anyway. Both my previous kids came out earlier at 39 and 38 weeks. So I have a feeling I'm not even gonna make it to 40 weeks. We shall see. I guess some people must just want to schedule an induction at this point to have it in the calendar just in case. I'm not exactly sure. And the last thing I want to talk about is this whole situation about my doctor pushing a certain medication on me that I just don't want to take. For my own privacy, I'm not going to disclose exactly what medication he was recommending for me or why, but I'm going to try to clarify as much as I can because I think informed consent is a really important topic, especially when it comes to prenatal care. So bear with me. So basically there's a medication that he was recommending that I take from now through delivery. I explained to him some of the reasons that I didn't want to take this medication, which was mainly to preserve my mental health. There are a lot of common side effects of this medication that mimic depression, and there are some less common side effects of paranoia, psychosis, and seizures, along with like a million other things. And some were very specific as well, like feeling like you're being watched. Very strange. I have a long mental health history of depression, anxiety, CPTSD, along with other things. There's kind of a laundry list, but my mental health right now is honestly the best that it has been since probably the blissful days of childhood. So it's really important to me to preserve this. It's taken so much work to get here, and I just don't want to do anything to jeopardize it. In addition to that, there were other reasons that I didn't want to take this medication, such as the likelihood that I would actually need this medicine for what it's intended to do is very, very, very low. Like I'm talking less than 1% low, according to credible sources like the NIH. Also, the drug hasn't been thoroughly, in my opinion, researched on pregnant women or breastfeeding women, and it's not even FDA approved to be used in the way in which it would be used with me. I know medications are used off-label a lot, but it doesn't make me feel any better. I'm not willing to be a guinea pig, and I am definitely not willing to subject my baby to being a guinea pig. So that's just my personal opinion. I didn't say that to my doctor, but I was definitely thinking that. My doctor responded by saying that none of his patients have ever complained about side effects due to this medication. He also said that we could just test out this medication, and if it doesn't seem to be working well with me, we could switch to another one, which on the surface sounds like an okay idea, but if it's not working well with me, that means that it's already messed up my mental health or some other side effect. But the most common side effects were all mental health related. It's already done what I didn't want it to do. If I take the chance, take it, and then it messes up my mental health, I'm thinking that could be really hard to get back on track. I know he's making it sound easy, like, oh, just switch to a different medication. Well, what if that doesn't help? What if this has started a snowball effect, and even if I'm off the medication, it's really hard to get my mental health back on track? I also don't want to go anywhere near postpartum depression. That's already a risk for everyone. If I'm having depressive symptoms because of a medication that I'm taking up into delivery, I don't want that to then just turn into postpartum depression. And when I still responded with hesitation, he then pulled the dead baby card. In my opinion, the dead baby card is basically a last-ditch effort that a medical provider will use to emotionally manipulate a patient into complying with a procedure, a treatment, an intervention, a drug, something of that nature. The key words there are emotionally manipulate. I want to make it very, very clear that I am 100% in support of informed consent. And there's a big difference between informed consent and the dead baby card, but I will talk more about that in a minute. My doctor told me that he saw one baby die because the mother didn't take this medication. And he obviously knows that I don't want my baby to die. I felt like he was ignoring the nuance that goes along with deciding whether or not it's a good idea to take a medication like this at this late of a stage in pregnancy. Okay, back to informed consent. I am 100% in support of informed consent, meaning that I think that doctors have a responsibility to explain all of the risks, benefits, and alternatives to a patient when they recommend a certain procedure or drug or treatment. I think that they should also take into consideration the chance of those risks actually happening with actual statistics. To take it a step further, I think they should then be able to incorporate the patient's specific history, religious beliefs, spoken wants, etc., into the overall conversation about deciding whether or not to proceed with a certain drug or procedure. So I'm not saying that my doctor shouldn't have told me that there's a risk that my baby could die. I think that's really important information for a patient to know. But I think the way in which he communicated that to me was not professional. So here's my advice. I think that it's always a good idea to hear out healthcare professionals because after all, they are the professionals and they have dedicated their lives to helping people like you and me. But I would not blindly take anyone's advice, and that includes trained professionals. Healthcare providers are not all-knowing gods. They are regular people like you and me. They make mistakes. It is always worth doing your own research, asking as many questions as you can, and sleeping on a topic, sometimes for more than one night before you make a final decision. So for me, this looked like searching the NIH website for statistics regarding my situation. I also asked the opinion of people that I trust, like my husband and my mom, what they thought. And lastly, I trusted my gut. The verdict that we came to at the end of my appointment was that we were going to order the medication in, and I would take this week to do some more research, think on it a little bit more, and make a final decision by my next appointment. So I have decided, as you can probably guess from this video, I'm not going to be taking this medication. I think that the chances of something going wrong for baby if I don't take this medication is really, really, really low, and it's not worth the risk of messing up my mental health. So that is how I came to make this decision, and I hope that my process of thinking through a risk to benefit analysis can be helpful if you find yourself in this situation. Like I said, it's harder when you're a first-time mom, and if someone tells you that something could potentially happen to your baby, it is like the worst news. No one wants to hear that, but it is especially scary for a first-time mom. In my first pregnancy, they told me that Adalia might have Down syndrome or some other type of chromosomal abnormality because she had two things: a white spot in her heart and one of her kidneys was retaining more fluid than the other. The doctors explained to me that on their own, those two things are kind of common in normal pregnancies, but when you see them together, there's a much higher risk for a chromosomal abnormality like Down syndrome. So they recommended that I get an amniocentesis, which comes with a whole host of other risks and complications with a procedure like that. And I was 20. So I was like, isn't this something that 40-year-old pregnant women do? Do 20-year-olds even get this? And in addition to that, they also gave me the option to abort her at my 16-week appointment, which was just wild to me. Absolutely wild that they even brought that up. And I know that they have to give me all my options, but it was just crazy to hear them say that. So I denied that abortion, and I also denied getting an amniocentesis. And in that situation, I should have said this: when you ask your family members or the people around you that you trust their opinion, it doesn't mean that you should necessarily go along with what they say either. It's just extra input for you. Hearing other people's opinions can be helpful a lot of the time. Maybe they've thought of something that you haven't. But in this situation, when I was pregnant with Adalia, my dad's a doctor. So I told him what was going on, and he thought that I really should get the amniocentesis. To me, it was too much risk involved, and the benefit of just knowing if she had Down syndrome or not wasn't great enough to me, because I didn't care if she had Down syndrome or not. So that's how I've dealt with that kind of situation in the past, and how I handled a situation like that this past week. So anyway, I hope you enjoyed this video. I hope that it's helpful to someone out there, and I will be back next week for my 35-week update. So I will see you in the next one. Bye.